Today we're going to talk about breaking bad news, and I'm sure everyone's already learned the book answer for how to do that, which includes several steps like assess the patient's understanding, asking them things like, what do you understand about your condition, giving a warning shot, saying something like, I have some bad news to share today, and present the bad news with words the patient will understand. Be quiet and listen, let them respond to you, and provide additional information if asked. Kind of an peeling the onion type method where you reveal more as they seem ready for it and develop a plan for follow-up care. And so everybody that goes through medical training kind of learns the way to correctly give bad news, but whenever you're in the actual situation where you're doing it, it can be a little more challenging, or patients may be hearing something different than what you're trying to say. And so today, instead of giving the book answer, we're going to hear from some actual patients who have been told bad news and what they think that the providers could have done better, or things that they did well, and just see how all of that flows in real life. So we have two people here with me today, Jamie and Valerie, that are going to share their stories. I'll let Valerie go first. She's going to talk about a time whenever she was given bad news, and then we can ask questions.
So I have a son who's now 11 years old, but whenever he was born full term. Everything was fine. We went home from the hospital, and I already had a child before, and everything was going just normal. And about a week after he was born, he stopped eating, and then over the next 12 hours or so started getting very lethargic and things like that. And I had talked to the nurse at the hospital the day before and kind of mentioned that he wasn't eating well, and they were like, oh, that's normal, just keep trying to feed him, he'll be fine. And so the following day, whenever he had completely quit eating and just almost to the point of turning blue, I packed a bag and headed to the pediatrics office to see what was going on. And I got there a little before they had opened, and again, they just put me in the waiting room and didn't take me back immediately. And I guess I didn't express the urgency of that situation like I probably should have. But in the waiting room, he did, in fact, turn blue and was struggling to breathe. And so whenever I got back to the room, my doctor wasn't planning to come in for quite a while. So the nurse came in and noticed that he wasn't looking well. And so she went and got the doctor that was there that morning, who was a younger doctor, a female doctor, who recognized that there was an issue. And instead of kind of walking me through what was happening, she just kind of calmly panicked, but sternly looked at me and said, something is really wrong with him. It's either his heart or his lungs. I don't know which, but we're about to find out. And so as a mom, I kind of went into panic mode at that point too. But we walked over to the hospital, and I don't think that they were walking me through step by step. There just wasn't time to do that in that situation. It was just chaotic, trying to figure out what was wrong with him. And so she did. She got someone to do an echo, yes, an echo on his heart while we were in the emergency room. And she kind of wasn't ready and willing to wait on the answer from the tech. So they kind of had a discussion, and she determined that it was coarctation of the aorta. And I had no clue what that was. It had never occurred to me that that could be a problem. And so from that point on, it was kind of having to learn as we went. And whenever we left there, while we were there, we were told by the pediatric cardiologist that we were going to have heart surgery. And I just assumed they would do it in our hometown. It never occurred to me that we would have to leave Shreveport, Louisiana, and go anywhere. And so that the doctor didn't really walk me through those steps, but turns out we had to fly. He had to be airlifted to either New Orleans, Dallas, or Little Rock, Arkansas. And so it was kind of, I think I needed more information to make a decision, but we had some medical professionals in our family, and so I kind of enlisted them to kind of give me some advice on that. We ended up choosing Little Rock, Arkansas. and he was airlifted up there. So the following morning, he had open heart surgery. And what I can appreciate was everything that Arkansas Children's Hospital did for us, from just walking through the front door to getting into the room with him. Every doctor and staff that we encountered really were willing to answer questions and went above and beyond to make sure that we were understanding what was going on, because I don't come from a medical background. So I think as a healthcare professional, people need to realize that you're more likely going to be dealing with people that don't understand the language and just the protocols that are in place. So to take the extra step to kind of help explain it was really nice to have. But right before the surgery, the pediatric the pediatric surgeon came out and drew a hand-drawn picture of exactly what he was going to do to our son, how it was going to go, and just really dumbed it down for us. And at first he asked us, "What do you know?" and kind of let us give a baseline, and then walked us through in a language that we could understand. So that was real appreciated too. And then we constantly got updates throughout the surgery, which was very nice as well.
And they gave you good information on what the risk for the surgery were.
Yes, it not only was life or death kind of situation, but there was other things that could happen, like clipping his vocal cord because it's so small, and so just knowing that he might not be able to cry after the surgery was something that it was nice to prepare for, and we weren't caught off guard when we got that news that it did happen afterwards.
Is there anything that you think one of the providers could have done better through the whole ordeal?
Well, other than catching it beforehand, if that was possible, but no, as far as like helping us, I appreciated the pediatrician that kind of jumped in and took care of our baby at the beginning, and then Arkansas Children's was amazing. I do think that there was a little empathy lacking in our pediatric cardiologist that we encountered that day, but he still gave us very solid information and helped us get to where we needed to be.
All right. So now we're going to hear Jamie's story of getting bad news.
So my bad news started in 2019, August 2019. It actually was about 4 months before. I was taking a shower one night, and I felt a knot on one of my testicles. That's hard to say in a group, I'm just telling you. But, yeah. So I felt a knot. So after I got out of the shower, I went to my wife and asked her to, feel and check just to make sure that it just wasn't out of the normal. And so she felt, and she said, "You're kind of out of the age range to have testicular cancer." I believe I was 41 then. So I said, okay, and I'm hard-headed. And I waited a few months before I scheduled an appointment. So finally, when we get to the appointment, I go to Dr. Wilson, and, we're sitting in the exam room, and he kind of tells me the same thing. You're kind of out of that age range to have testicular cancer, but let's do a ultrasound just to make sure. So go in the ultrasound room, get in there, and they do the ultrasound. I get back to the exam room, and I'm going to have to wait for him and the results, and it starts taking a little bit longer than normal, or at least it did in my mind, and so there was a little bit of anxiety build up there. But he comes in eventually, and he sits down beside me, and he pats me on the knee and goes, "Well, it's not good. Do you want to have surgery tomorrow or Monday?" This was a Thursday, so I could either have surgery on that Friday or Monday. Never once did he tell me that it was cancer, which I truly appreciate. He was just real sympathetic and compassionate with it. And you already knew when he says it was bad, right? So we ended up having surgery. And it wasn't, I guess the right word was, required to do the one little round, the chemo.
Radiation.
Yeah, the chemo. But we elected to do it anyway. And so we did that. And after that's done, you had to go through a series of scans once every 6 months for 2 years. And so we did that, and I was on total of 4 scans. I was on my 4th scan 2 years later. By that time, I'm seeing my oncologist as just strictly him, Dr. Lash. And I go in after the scan and not expecting any bad news whatsoever because I'm thinking we're good. It was a less than 1% chance that it would ever come back. And so I get in there, and he comes in, and he goes, well, we've seen something on your PET scan, and I'm recommending you for MD Anderson. Well, at that point, I was just kind of I lost it at that point, just kind of freaked out because it kind of hits you like a ton of bricks. And so we're sitting there, and, I also have Crohn's disease. He goes, well, let me call the GI doctor and let's discuss if the scan could possibly be showing a flare-up with a Crohn's or anything like that. So we went through that, and him and my GI doctor both agreed that it wasn't Crohn's. And so we started to schedule an appointment with MD Anderson. So with that said, the first time was like a whirlwind. It happened, everything kind of happened really quickly. And as far as, I'm big on personal attention and trust. And so with Dr. Wilson, Dr. Wilson was great. Everything personal attention, even through the surgery. He even called a couple weeks later to check on us and things like that. Now, fast forward to MD Anderson. Now, MD Anderson, everybody knows, is probably one of the best cancer centers in the world. But with that comes everybody wanting to go to them as well, so you had time there. So we tried to schedule an appointment, and it was 3 weeks out. So by the time we get to the appointment, you've had a lot of time to sit and stress, think, worry, whatnot. So we get to the appointment, and when you first go to MD Anderson, I had to see a surgeon first and then the oncologist. So we get to the surgeon. Was not one of the best experiences I had because he went straight into, hey, it's going to be like an 8-hour surgery. We're going to take the lymph nodes out of your abdomen and may have to flip you over during the surgery and get the backside because it really just freaked me out. It's not something that I really wanted to hear at that time. But I understand he was giving me the information that was needed. So we get done with him, and I had to do a PET scan there. Did a PET scan. The next day I go see the oncologist. We get to the oncologist and start the appointment, and he's got my PET scan pulled up on the screen and basically says, I don't see anything. I think you may just be sick. And he just started talking to where I almost felt kind of stupid for being there, right? And I didn't want it. Luckily, my wife being in the healthcare profession and knowing me extremely well, when I get really frustrated or upset, I will duck my head and I will not say a word because I know if I say anything and lift my head, it's not going to be good. So she starts talking to the oncologist there. They start going through the PET scan, and she has to show him exactly where it's at on the lymph nodes. And once he realizes it and sees it, then the whole story changes, right? I was not a fan of being there from that day on. And like I said, I know MD Anderson is probably the best cancer center in the world, and I only saw 2 out of the many hundreds of doctors, but I was not a fan at that point in time. Long story short, so he has they're looking at the PET scan. He sees it. Well, now he wants to do a biopsy of the site and to make sure that it is cancer.
Or the same kind of cancer.
Yeah, the same kind of cancer. Well, problem with where it was at, so they had to do a couple of things, and that's where I was fortunate to have MD Anderson because I believe they were one of the only few that would do that. So we get the results back from that, and it is the same kind of cancer, and we start a regimen of chemo and radiation. Finished that, and now I'm on my scans. I will say that I love my oncologist I have here, and I was fortunate to, once we got the plan of the chemo and the radiation rounds that we had to do, I had the option of doing it at MD Anderson, or I could do it back here with my oncologist, and I chose here with my oncologist because we would be at home as well. And it turned out really great. So my biggest thing with all of it is, like I said, I'm big on personal attention as a healthcare provider, and I know they have to see hundreds and hundreds of patients, all the time, and it gets wearing. But when we talk to somebody about possible life or death or cancer or whatever it may be, a little bit of compassion and personal attention go a long way, because you never know what that person's thinking in their mind. You never know how they feel. And that's why out of this whole situation between the oncologist I have here, Dr. Lash, and Dr. Wilson, I don't think there would have been two better ones for me to go to.
Was there anything that you thought either one of them could have done better?
Some people may say Dr. Wilson probably should have let you know you have or said the word, but no, I don't. I think he handled it the perfect way for me. I think he just could feel the anxiety with me, and he handled it the perfect way. Dr. Lash is always wonderful. Always says the right things. He's a real dry guy, but you know that he cares.
That issue where you were talking about being at MD Anderson and the doctor missing what they should have seen on the scans or that's kind of where we were too. With in our mind, this had been missed with our son, and it really hadn't. It didn't present until a certain point, but as a mom, I thought it had been missed by a healthcare professional. And so when we got to Little Rock, I was kind of OCD and like staying in the room and reading all the monitors and, are you checking that? Why is that beeping? And I know as a healthcare professional that it's really irritating because you're doing your job and you're doing it well, but they were very kind and understanding, knowing that as a mom, you have different worries. And now I had a fear that something might get missed, even though they're very confident, but they took the time to answer my questions and not get irritated with me. And so I thought I kind of appreciated that too, till I could get my trust bearings back.
How have all of the follow-ups been since then? Is there anything that you think could have been done better during those?
No, now we go annually. I didn't say how he is. He's completely fine. We do see the pediatric cardiologist once a year, and we've had great follow-ups. We just kind of keep watching. There's a little narrowing in his aorta, but it's not anything to be concerned with. But they're very thorough, and I appreciate that because I need that, so my worries subside for a whole year before I have to go back to see him again.
And that just like before every scan I have to do. So it was every 3 months after the second time for a year, a little over a year, and now we're at every 6 months. But even before every scan, there's just this fear and anxiety that comes over you. Well, what if it's back? And then when you get there and you're looking at the scan, I'm sitting there trying, and I'm an untrained eye, but I'm looking at every little thing because I don't want anything to be missed at that point, right? But so,
Do you think that the reason that the oncologist at MD Anderson thought that maybe that's not what it was because of the location of the recurrence?
After he saw where it was, yes, possibly.
Was that a normal place for testicular cancer to recur?
I don't know.
It wasn't.
Okay.
So I think that might have, not trying to make a big excuse or anything, but I think that might have been a little bit of the confusion, especially with them trying to determine what type of cancer, making sure it was the same thing.
That's why it's great to have a healthcare professional with you.
Yes, it is.
When you're talking to them.
It is.
And with yours, do you think it would have, how do you think that the cardiologist here could have more clearly communicated that you would have to go somewhere else to have the surgery?
I think he was very direct in how serious the problem was and how rare the problem was. But he probably should have started a little lower on the knowledge scale for me and just kind of walked me. I honestly didn't even know it would take surgery to correct at first. When they shaved his head to get a central line in, that's when I flipped out just from shaving his hair. I mean, I had no idea they were going to cut him open and do a surgery. So, I'm an educated person, but I'm not educated on any of that. So I feel like a lot of people, like PAs, need to be real, we have them so that they kind of have a little more time and experience to talk to these patients. So I think it would be great if they could just ask the question, what are you understanding is happening right now?
Yeah.
And then start there.
Did any of them assess, like, your baseline knowledge? Like, what do you do for a living or anything
No.
like that? Yours was more of an emergency, but did anybody say any of that to you?
No. It was, I think the first time, like I said, it was a whirlwind, so it just kind of happened, and it happened really quick. The second time with Dr. Lash, I think he was just as surprised as I was because of not expecting a reoccurrence. But nobody asked what, any type of knowledge I had. So,
And something that's been brought to my attention, and I think it's important, you might go over this, is making sure they have a support system with them and not leaving them to kind of live in fear for the moment.
That's true. Did you have anybody with you that day?
I didn't when I first arrived, but I quickly had my sister and my husband with me.
What about you?
no, I did not have anyone with me. Making phone calls to quickly get someone there, especially the second time, grown 43-year-old man at the time, bawling, wanting his wife to be there, somebody to support him and basically just make him feel okay.
Yeah, a support system is very important. Because I feel like sometimes the person that's getting the bad news, it might be difficult to, like, your brain kind of shuts down, so it's hard to ask good questions. So I think that it's good to have somebody else there that might be a little more clear-headed at the time to ask questions so that you get a better understanding of what's going on.
Absolutely.
Yeah. Is there anything else that y'all want to share?
No, I think we're good. Thank you.
Just have some compassion.
Yeah.
All right, thank y'all. So today we're going to talk a little bit about difficult situations you can have with patients. And so this one's more of a sensitive topic, but I feel like it's a good thing for people in the medical profession to see and be able to talk one-on-one or in a group with people who've been through it. And I know that's not as common, but today we're going to talk about dealing with victims of sexual assault. And so I have a guest with me today, Valerie, that's very generously willing to talk about this with us. So I'm going to let her tell a little bit about her story, and then we'll talk about some of the things that have been issues or things that are concerns during healthcare visits after all of that.
Thank you for having me. So my story goes back about 25 years ago. Whenever I was 14, I was at home alone, and a stranger came to my door and pulled a gun on me and kidnapped me from my home. He drove me several hours from where I was from, and held me captive all night and raped me throughout the night. And then the next morning, he decided to let me go. And so that's a very quick version of what happened. I'm always willing to go into more detail, but I think what you just need to understand is that I was a victim of rape, and the way that it worked is once I was able to get away and call the police, a detective showed up, a male detective, and before he took me to the hospital or to my family, he made me guide him back to where everything had happened. And at this point, they had not caught my offender. And so that was a little traumatic in itself, just being with a male that I did not know, and then going back to a place where this man might still be. So after all of that, I ended up at the hospital, and I'm sure you're very familiar, but they do have a SAVE representative, or a sexual assault and violence, SANE nurse examiner, sexual assault nurse examiner, that will treat you. And now I think every healthcare provider can apply to do this, PAs included. But so once I was at the hospital, they started that process before my parents or my mom was able to get there because it was so far from our home, and by the time they figured out where I was. And so I think just kind of stopping here to say that it would have been a lot better situation if I had had some kind of support there with me. They did have other women in the room with me. It wasn't just me and this nurse. It was people who also helped collect the evidence. But I needed my mom at 14. But she did come about halfway through, and so we finished the exam. And I was able to leave with them that day. But you want to ask about?
Yeah. So with that, other than waiting on her to be there, is there anything else you think that they could have, that would have made you more comfortable?
Yeah, it's been a long time ago. I'm trying to remember everything, but when you're raped, that's so intrusive, but also like going through this exam it's a lot too. You're stripping your clothes off, and they're poking and prodding you in all the same places that you've just been violated. So it's just to have a lot of compassion when you're doing this, and gentleness, and kind of walking through, kind of give clear instruction of what you're about to do before you do it. So to kind of help control the panic, because I think without that I probably would have been panicking, not knowing anything about how this was supposed to go. Because when you're a child, you don't think this is ever going to happen to you. It's not a scenario you play out in your mind and or you're prepared for. But yeah, they were very kind, and I think the people who do that are trained really well to have that sympathy or empathy, whatever they need to do that job.
All right. So after you returned home following all of this, how were things there? Were there any emotional or physical issues that arose shortly after that needed to be addressed?
So I think I surprised my family when they arrived at the hospital to get me. I think I seemed completely normal, like nothing had ever happened. And so I'm getting back home, and the days that followed, same thing. I tried to mask my emotions, I guess, and eventually that forms cracks, and that cannot go on forever. And so our small town, we didn't have any resources for mental health, or even like a PCP that would be able to has dealt with victims of sexual assault in that way before. So those were all hurdles we were trying to get through, and also we didn't know any better. I think we needed guidance on everything. So I would go to the doctor in this small town where everyone knows everyone, and I would still get asked the same questions over and over about, say, sexual partners or that kind of thing. And then, I did finally eventually get to a doctor that was able to help address the anxiety and depression that had kind of started to really show. And so at the time, I think Paxil was the only medication on the market that really would work for what I needed, but it was also not a great drug for a 15, 16-year-old at the time. And so it came with a lot of side effects that I don't think were really, I don't think I was really aware of what would happen by taking that. So that was other issues that we had to deal with as well.
Like what?
So like constipation, severe constipation, weight gain, and just almost like a dullness.
How long did you stay on that?
I stayed on it about 6 months, and the side effects really were, I think, harder on me than the benefits I was getting from it, so I weaned myself off. And since then, there's been lots of prescriptions on the market that do a better job, and so I've tried different things over the years, and I'm generally very stable. But like when my son had his heart condition issues, or if there's anything that kind of is a spike in trauma that I have to deal with, sometimes I need to get back on it to kind of help stabilize me. And I don't know if that's lasting effects of what happened to me or if it's just normal mental health issues.
Other than that, do you have any other, have you had any other issues when you've seen healthcare providers for whatever reason? Is there certain things you prefer over others?
As a victim of rape, I much prefer female providers whenever it comes to like my OBGYN type health care. Both of my children, I had a female OBGYN, and still to this day I still do. And there's nothing wrong with males in those roles. I mean, we need them. I just, in the off chance that you do find yourself with a patient that might be a victim or is a victim, don't take offense to that if they request a female over a male.
Okay. Do you think that the Paxil helped at the time?
I think it did. I think I needed something to kind of jolt me back into a rhythm that I could handle. Also, talking about it is very healthy too, and I don't think I got enough of that growing up. I think my family was very concerned with bringing it up, and hindsight, I feel like it would have been better if I'd had maybe a professional I could have talked to as well.
Have you experienced any of that since then?
I've never sought counseling out until here in the last couple of years, and I wish I had before now. I didn't realize how helpful that would have been, and so going through that process, it only took 3 sessions, and he fired me as a client because basically having been a victim of kidnapping and being raped, you don't have control in that situation, and so all of my issues stem from trying to control everything around me. I guess that's my safety, blanket that I keep. And so if I could let that go, I could let a lot of the trauma, stress go as well.
Okay. Well, thank you for sharing that with us. I know that was a difficult thing to talk about, but I think that it's very helpful for future healthcare providers to hear from the person rather than from a book on exactly how to do it. With this and with the breaking bad news, the way that you go about that, I think that it's good to hear it from people. So I appreciate you, and that concludes our talk today on these topics.